Okay, sorry, I just switched over and I do see that we do have 9 attendees signed in. So let's get going then. Okay.
All right.
So, yeah, so I'd like to welcome everyone to the Process Fusion Healthcare Suite Reimagining Print Management webinar. My name is Jeff LeBlanc. I'm the product marketing specialist here at Process Fusion, and I've got Jeff Maxfield as my guest speaker. He's the Director of Technical Services at Parkland Hospital.
Welcome, everybody.
Okay. So just, as a brief introduction, want to go over the agenda for a moment. So just want to talk briefly about Process Fusion, just explain a bit about who we are, a little bit of an overview about the state of printing in healthcare currently, and then move into the discussion topics with Jeff as to his business challenges, why the solution was important for Parkland Health, and also some recommendations, and then get into questions and answers. If you do have any questions, please type them in the chat, and we'll get to them at the end. Okay. So just a little bit about Process Fusion. We're a software company, cloud innovator. We do have 2 main platforms. So what we'd like to do is take inefficient, paper and labor-intensive business processes and make them easier for you. We've been in business for over 20 years. We have 4 locations worldwide. We've processed over 50 million documents in our cloud, and we have over 10,000 satisfied customers. The 2 main parts of our PF360 platform that I was talking about are the PF360 Capture, which processes invoices, e-referrals, which is something that we do for diagnostic imaging specifically. Also have fax management and digital mail. On the printing side of things, we have direct IP printing, secure printing, mobile printing, virtual desktop printing, and what we're here to talk about today, the Infinity Healthcare Suite. So we just got a few of our global enterprise customers up here, just so you can see some of the people we deal with. And so I know that one of the things that's very important in the healthcare industry is security and compliance. It is something that we take very seriously. We are certified in SOC 2 Type 2 compliance, so we're audited on that on a regular basis. Make sure we're following that. We're also ISO 27001, 17, and 18 officially certified. So the 17 is cloud computing specific, and the 18 is for personally identifiable information. We are also HIPAA compliant, which I know is a big concern for a lot of people. So you might be asking, with all the talk of printing being dead and dying, why does printing in healthcare still matter? We do have a few different reasons. Ease of accessibility. If you have a hard copy, it's very easy, just go grab it instead of having to search through a bunch of digital files or images. Regulatory concerns, make sure that you've got things backed up properly to document things for regulations. Discharge packages for your patients. So once they're leaving, if you've got aftercare instructions, contact information, things like that, if it's printed, it makes it a lot easier for them to look through it and take it with them. For prescription labeling, want to make sure that prescriptions are handled securely and that labels are printed correctly and on the right type of paper for both of those. As a backup, so having a paper file backup somewhere is always a good thing. And also some legacy systems just really aren't that great at integrating with digital solutions. So then having things printed out is good in that case. So some of the challenges in healthcare printing today, printing from EMR, EHR systems, those don't generally play well with printers that much. And it's often a challenge to know which printer to print to, and those systems often have a limited amount of printers that you can install. Security and privacy, you don't want people printing out things and then they've been sitting on the printer for a while and somebody else grabbing them and seeing some patient information that they shouldn't see. The lack of centralized management with most things, if you're doing things like direct IP printing and doing it on a per computer basis, makes it very difficult to get everybody with the correct drivers, get everybody with the correct printers. So a centralized management system saves you a lot of time and effort that way. Printing errors, again, you don't want to be printing things like wristband labels onto a regular color paper sheet and then have to do reprinting. That's not good for anybody. Compliance, again, making sure that things are printed where they should be and released to who they should be released to is also very important. With respect to cost, environmental impact, mentioning printing errors, if you have to reprint things, then that's going to drive up all your costs. And that's something that probably nobody wants these days. And also the environmental impact, not having to get rid of excess paper, that's always good for the environment. One of the last things I want to talk about was workflow interruptions. So when people are printing things out, they're usually in a fair amount of a hurry. They want to get things printed quickly and accurately. They don't want to have to go print something, run over to see if they can find it from a printer, and then come back in and have to reprint it. So a centralized print management system will help with that as well. So some of the benefits, again, the centralized management of the system saves you time, saves you help desk calls. We have one client who was able to get rid of 75% of their print-related help desk calls when they switched to a centralized management system. Again, the integration with EMR and EHR, being able to print front end and back end from the EMR systems is very helpful. Ease of compliance, make sure that everything prints smoothly, get rid of print errors, and also your smoother workflows. So the next part is just a little bit about the Infinity Healthcare Suite. So our Infinity Healthcare Suite consists of 3 modules. There's Smart Route Printing, which makes it easier to print from the EMR EHR systems. When you're logged in, say in the morning at the emergency room, you print to the color printer. Our system will automatically route it to the color printer in the emergency room. And then if you're in the operating room in the afternoon, when printing to a color printer there, it makes sure that everything's routed to the proper printer that's next to you to save time and make you not have to memorize complicated locations printers. We also have the high availability portion, which ensures that you are able to print 24/7. And we also have a label printing module, which helps print errors in labels, wristband printing to make that easier for you. We do have integration with Improvata single sign-on, so that makes it easier to log in everywhere and integrate that with your healthcare suite, your EMR system. And we also do offer Epic backend printing. So now we're going to move on to the discussion portion with Jeff. And so that's just a picture of Parkland Hospital. And then I'll let Jeff, who's the Director of Technical Services of Parkland Hospital, do a little introduction of himself. Over to you, Jeff.
Thank you, Jeff. My name is Jeff Maxfield, as the IT Director of Technical Services at Parkland. We've got a very large environment, tons of printing. Printing is dead is not something I've ever heard. We spend a great deal of money on printing. It's great to be here, and I look forward to having a discussion with you guys.
So let's move into the first question. So what were some of the business challenges that you were encountering with printing that prompted your team to look into a new solution for print management?
Prior to Process Fusion, we actually had 2 different applications that we were using to manage our environment. Very problematic, 2 upgrades, making sure the products interacted with one another. We had application compatibility issues. Most of our upgrades required uninstall, reinstall, reboots. We had unsupported workflows. Birth certificates weren't printing. We had issues with our jail health vendor that wasn't working very well. Refreshing printers required us to reboot our systems. Lots of issues. Lots of time watching our guys spend so much time trying to manage the application rather than doing all of the other things caused us to go out and look for a better solution.
Okay, thank you. So kind of 3 things that are interrelated. How did we manage to help you? Were there any speed bumps that you got into during the POC or deployment, and how did we overcome them for you?
We'll start with speed bumps. Yes, there's always speed bumps anytime you're looking at a new product or implementing anything that's going to happen. It's expected. None of the speed bumps were impacting our rollout. We had some issues with load balancers not being compatible. I think when we initially started working together, Process Fusion was on a different version of Epic than we were. We didn't have some particular servers we needed. All of that was easily overcome. It was seamless. How did you help us? Well, let's see. We increased duplexity by 30%. I'm down to one software that doesn't require me to reboot or uninstall and reinstall every time I run down. With some of the settings, you were help us to get better control of our color printing. So we were down to 12% house-wide printing in color. The badge release is much faster, which is nice. We can map our printers through some of the software that we use that we couldn't do before, where we had to do IP-based printing. We can now manage that from a central location. Had a reduction in the number of servers that were needed. Lots of ways that Process Fusion. What was the third question?
So how did
we help us overcome? Well, you were crucial. I think access to your development team was an integral part of rolling this out. I think that one of my key engineers, I'll give him credit, Alvin, was fantastic in working with your development team. That was phenomenal. And together we were able to customize solutions for integrating with our load balancers, to creating custom code with the badges or the badge that we have on our printers that allowed badge release. Initially, we were going to have to buy all new badge readers across the hospital. Got a lot of printers out there with $300,000 easy. But with the development code that you guys worked up for us, we did not, and it was seamless.
Okay. Sounds good. So I guess in the end, I'd assume you probably looked at a few different solutions. Why did you choose Process Fusion?
Well, during the vetting process, I think Process Fusion really took the time to listen to all of our issues and offer solutions. Where they didn't have solutions, they offered their development team. They were upfront in our ability to build a solution. Out of the box, they were able to cover most of what our needs were. And you were the only vendor that offered to work directly with your developers and develop a solution for the badge readers. Most of the vendors we talked to would require us to purchase badge readers for all of our printers. Instead, you guys recognize the cost that would incur on the county hospital and build for us. Those were the key factors, and price, of course. A reasonable price is important.
Okay. So if other folks are looking for an enterprise print management solution, do you have any advice and recommendations for them?
Do your homework, do your research. I highly recommend looking out and shopping around. If you want control of who prints what in your environment, I believe this is a good solution. I think it's a great solution. It's been extremely beneficial to us. The transition was seamless. None of our users knew that we had even migrated. I recommend you tell Process Fusion what you need and what you want, and they can make it for you.
Okay, thank you. So that was the last one of the questions that I had for you. I wonder if there's anybody in the audience that has some. If you do have some, please type them into the webinar chat. We do have one. They're asking how kind of specifically you're using the system in your clinical environment.
Clinical environment. We can now print all of our birth certificates. We can print all of our ABS, all of our the badges, not badges, the bracelets that our patients are wearing. We're able to print all of those. The centralized print queue simplifies management. Right? It's easy. As an administrator, we only have the one queue instead of multiple queues for each printer. The badge release process we use a lot that allows you to print a document, and then it doesn't show up on the printer until you walk over there. Add this a nice layer of security. I think overall this approach streamlines the printing process for our users and my administrator.
Okay, sounds good. We'll just give another moment here. Don't see any other questions at the moment. I guess we'll ask if anyone else has any questions. No? Okay, well, just a little bit about me. Said product marketing service delivery manager here. So I help customers decide what they need and try and get them, get them what they need to fulfill their requirements. So I'd like to thank everybody, especially Jeff, for your time today. We'll give everybody back a little bit of time so they can get on with their day. And again, thank you very much, and have a good day.
Thanks, everybody. Thanks, Jeff.
Thank you.